Transcatheter aortic valve replacement, or TAVR, is basically a procedure that we replace the aortic valve with an artificial valve, and this is done normally through the groin. TAVR is designed for patients who have severe aortic valve stenosis. The aortic valve, which is one of the 4 valves we have in our heart, became dysfunctional, became too narrow. When that happens, we have to replace the valve.
Patients have multiple options when it comes to treating valve disease, and so often people wonder, what are my options? First-line therapy, mostly for an aortic valve stenosis, is a TAVR procedure over surgery, especially for patients who are older than 65 years of age. A TAVR procedure is often much quicker than a surgery. It doesn't require a general anesthetic like surgery, and they have a much shorter stay in the hospital, and their recovery at home is much faster, which is why for patients who are eligible for a TAVR, they often feel like they're very happy that this is an option.
Most patients, they come in, they have symptoms such as shortness of breath or fatigue or leg swelling, and some of these symptoms can be debilitating for these patients. As soon as we do the valve, most patients feel the shortness of breath is immediately relieved and their breathing is much better.
Performing a TAVR is a complex procedure, requires multiple individuals on the team, and 2 of the leaders of that team is an interventional cardiologist and a cardiac surgeon. It's an important partnership that we have together in order to provide the patient the best outcome possible.
The majority of our patients, 95% of our patients after TAVI, they go home the following day. So we come here, you get your TAVI done, next morning you go home.
After a TAVR, the patient should expect to have at least 1 week's worth of no driving and no lifting anything greater than a gallon of milk, because we access patients' groins, both groins, and we want to make sure that those heal properly.
University Hospitals has been involved in TAVR since its very beginning. We are one of the highest volume centers in the United States with TAVI, and we have been very heavily involved in how to optimize this procedure as much possible to patients. We have a team of folks, a team of physicians here that have done thousands of TAVR. I have done more than 4,000 TAVIs myself, right? So we have a large amount of experience. This level of expertise is unique of university hospitals.
One of the most rewarding things is the immediate morning after a TAVR procedure. It's amazing how quickly people feel better, and it is very satisfying on rounds the next day when you're going to check on your patient and they tell you, wow, I've never breathed like this since I was 18 years old.
We do this procedure, and then all of a sudden these patients have like a new lease on life. And that, to me, is worth its weight in gold.
To be able to see these patients providing a positive feedback that they can live their lives again, to me, that's priceless, and that's why it's very rewarding to me.